just remember you are not alone. We have a community. And people are trying to help, but sometimes the people around you may not know. It's not like parents get a crash course on how to care for a sick child all of a sudden.
Yeah.
Or a wife or a husband to learn. I mean, we're all learning this together.
Absolutely.
So I think that's the most important thing. Just remember that. Don't be afraid to reach out.
So we try to kind of
all these tests.
I retired, I mean, obviously, but thankfully,
So in my immediate family, like my parents, I'm the eldest of 6, so
okay.
So I didn't really have anyone higher to go to per se.
Right.
And as I was the eldest and I was the first physician in the family.
Right.
So my dad's an aircraft engineer. My mom's a stay-at-home mom. So we're not a lot of medical people. So what's MS? What do you mean? No, doctor told me that my body's attacking myself. So but they were like, okay, I guess, you, alhamdulillah, you'll figure it out. That was my family. A lot of us we'll take it day by day. Now, I think one of the things that most parents do and having children, I don't know if you have children, but
not yet, but yes. I am aware though of the
we want to support our children.
Exactly. Yeah.
So when our children are sick, you want to kind of baby them, take care of them. But you got to remember, okay, I'm sick, but I'm not going to get better anytime soon. This is something I'm going to live with probably for the rest of my life. So at some point you need to accept, it's okay, you're Ahmed. This is, you're no different than anyone else.
Yes.
And I think a lot of parents, they think they want to support you, but what they're doing is that helicopter type parenting. They want to just try to protect you in a way or keep things. No, it's all right. You're going to fall down like everyone else. And if you fall down, doesn't mean that you need extra attention. No, it's just, it is what it is.
Yes.
And it's no fault of their own. I think, I'm guilty of that, being a parent. That's why I asked you, and if you ever have kids someday, you'll probably be guilty of that also.
Yeah, absolutely. I see it with my parents. I mean, to me, until today, I mean, it just makes sense.
Right?
Yeah.
We just get babied, but yeah. And then when I got married, my wife, she's been very supportive, and her family, you're like anyone else.
Right.
I'm going to pick on you, whether you have MS or not, and her siblings, I'll pick on you. Same way, you're Ahmed, yeah, you have MS, but you're still Ahmed. We're still going to make fun of you for the goofy things you do, regardless of whether you have MS or not.
It's very progressive, I have to say, because unfortunately, as you mentioned earlier, not a lot of people think that way, unfortunately.
Yeah.
And it's not so much the people with the disabilities' fault, it's the society's fault. I mean, if we're not accommodating to certain disabilities, that's on us. It's not on the person that's going through this tough time. And it's something that we have to reflect on.
Yeah, I mean, I think, you see, Arabic for me was a second language.
Okay.
I was born and raised in the States, so learning Arabic, I only got up to 5th grade Arabic growing up.
Okay.
But, there's, again, one word, and I think is the word ma'ak.
Yeah.
Again, I think in Fusha, that is the correct terminology. Someone that has a disability. But as kids, we didn't use it like that.
Nope, we did not.
And so in the back of your mind, when you hear that term,
it's very derogatory.
It has a very negative connotation.
Yes.
So one of the things that I applauded, I was so happy when the country changed that word to POD, people of determination.
Absolutely.
Because I was like, if you want to change people, you have to first change how we refer to each other.
Absolutely.
And by just a simple word, it changes the conversation.
Absolutely.
And like I told you, maybe the word mock is correct, but it has this negative connotation because when we were kids, we were not talking to each other in proper Arabic Fusha.
No, we were not.
Right?
Absolutely.
So something like that, it matters. It makes a
Yes.
huge difference.
Absolutely.
And how you view people with disabilities. I'm just like you. And I always talk about this, and when I first met His Highness Sheikh Mohammed bin Zayed, it was around 2021.
Okay.
It was the launch. At that point, the MS Society was just an idea.
Okay.
Just an idea. But that was the beginning. And I had the opportunity to meet him. He was still the crown prince, was not president.
Mm-hmm.
And it was a large gathering of people. And, I'm just in my wheelchair. And he came up to me. But when he came up to me, he came down to me.
Wow.
Yeah, you know what I mean? As someone in a wheelchair, having someone in such a position, in a way, come down to your level, if you want to call it such, it meant the world.
Oh, absolutely.
I was ecstatic. I'm like, he looked at me as a person. And I think viewing people as who you are means maybe someone not in a wheelchair would say, oh, yeah.
Yeah.
But being in a wheelchair, that was as important, if not more important, than everything else. It was during the Formula One event. And I remember it was like it was the Formula One race. And people came up to me and said, who won? I'm like, I'm a Sheikh Mohammed.
Yeah, I know.
I mean,
I'm stuck at that moment.
I remember like that because it was, I think Hamilton had like some huge uproar towards the end. Like it was last minute when people guys like, did you see the final? I'm like, I saw Sheikh Mohammed. And because it meant so much. It's just one of those things you can't describe.
Yeah.
But it means the world. And when you see during the Abu Dhabi Award, when I was invited to the Abu Dhabi Award, and you see how society I always believe that we lead by example. When you show compassion, when you show that you are as good as anyone, there's nothing wrong with you.
Mm-hmm.
People will view you as such. And during the Abu Dhabi Award, I was there, and I saw a human being come down and meet one of the contestants, one of the winners, in a wheelchair. He kind of crouched, came down, and he's a tall person.
He is, yes.
He is,
Mm-hmm.
and you could see that he's pretty much almost sitting on the ground, but just so that he could be eye to eye with her. And like I said, maybe for someone not in a wheelchair, you wouldn't appreciate it.
Mm-hmm.
But someone in a wheelchair, you see that, and you cannot help but feel like you feel a sense of pride.
Absolutely.
And that, yes, thank you.
Yes.
And I think it's gestures like this. It's things where people view others as we are equal. We are not less of a human being than our colleagues or our friends.
Yeah.
I'm a regular person, and I'm being treated as such, for the good and bad.
Mm-hmm.
And that's all we ask for.
This is what I love about this country. I mean, the UAE is my home, honestly, and I always say this because time and time again we've seen the leadership lead by example.
Yeah.
Whatever they say, they do. I mean, they themselves start doing before they tell anyone else to do.
Exactly.
And they honestly see the opportunity in every single person that comes into this country. And I could not agree more with the saying that you just said. They lead by example.
Yeah.
And we're very thankful for that.
I am. I always talk about this, and I try not to get a little bit teary because it means so much to know that. Because you don't expect it. You're not asking to be treated like that, or you don't have to. I'm just a guy in a wheelchair.
Mm-hmm.
But to be viewed as such, it means the world to that person.
Yes.
And for other people to see that, then they would also view, hopefully the idea is you want that image to resonate.
Yeah.
Not just to me, but to other people with disabilities. And I think that's one of the things I always come up loss of words with that.
Yeah, no, but it honestly, I was speaking to another guest on the show who has an inclusive program because of her brother. It was inspired by her brother, who is a wheelchair-bound individual. And she was saying that they want to be seen. A lot of people with disability feel like they're not seen, and they'd rather be invisible because they worry how they would integrate in society. So His Highness Sheikh Mohammed bin Zayed, by doing that, but through a simple gesture, he's saying, I see you.
Exactly.
Yeah.
I see you. You are like anyone else.
Exactly.
And I'm treating you like anyone else.
Mm-hmm.
And it just it humanizes him and it humanizes you, makes you feel like I'm not less of a person.
Yeah.
I was ecstatic. I remember it happened 4 years ago. I was just
over the
smiling
moon, yeah.
for like 2 weeks, and I still talk about it. Get a little teary 4 years later.
Yeah.
Because it's one of those things that it's a nice thing being someone.
Yeah.
And just in a wheelchair.
Yeah, it's a moment. Okay, so can you tell us a bit more about how you got through medical school after your diagnosis? I mean, that must have been so challenging. I'm thinking if I was in your position, I would have given up. I would have felt like, okay, this is the end of the world. Like, I'm done. So how did you get through that?
I'm stubborn.
I like that.
Oh, man. I think part of it was, this is what I always wanted to do. I always wanted to be a doctor, a physician, ever since 4th grade.
Mm-hmm.
Even before I even knew what it is to be a physician. The idea was I want to be a doctor when I grow up. And so I got sick. Well, okay, but I still want to be a doctor.
Okay.
So the question wasn't that if I want to become a doctor, it's what type of physician do I want to be? And that's where all medical students struggle with throughout their training is, okay, what type of doctor? You want to be internal medicine? You want to be a surgeon? You want to do neuro?
Right.
You go back and forth through all of these things. And I did the same thing, but neurology just seemed to make sense for me. I mean, when I was in medical school, I remember back way early when I got diagnosed right after biochem, I told you. Mm-hmm. The next unit was neuroanatomy. Just happened.
Wow.
I printed out my MRI report, and I'm reading my MRI report, and I'm trying to see, okay, if you have a spot here, what are the symptoms here? Which one of these spots in my brain can cause double vision? So it became like a puzzle. I'm like, okay, makes sense. I have an interest in it. I have a vested interest, I guess, to learn this and learn it well. So I said, okay, why not be a neurologist? And at the time I said I wanted to be a neurologist because I have MS and I want to take care of people with MS. Mm-hmm. But then I graduated and I saw what an MS clinic looks like. In 2005, I graduated medical school. Now, if you go back to 2005, the world of MS is way different now than it is than it was in 2005. What do I mean by that? In 2005, we had 3 medicines, and a 4th one had just got released, or it was starting to get released, but we had those 30% effective meds, okay? If you go to an MS clinic in 2005, 50% of the people either were in wheelchairs or on crutches or in beds.
Okay.
I wasn't that, and I couldn't help but seeing that's how I'm going to end up. And it scared me to death. So I said, that was my denial. I don't want to do MS. And I didn't do MS. I graduated, I did neurology. I actually studied neurophys, epilepsy, and carpal tunnel or electrophys.
Right.
When I came to the UAE in 2012, I remember my first patient. His name was Amjad, and I said that in the award ceremony. Amjad was this person. He was like 18 at the time, with his father, newly diagnosed, and he was just like me with my dad. There was so many flashbacks. I saw that. What he was asking me, the way his dad was asking me, was like as if it was my dad asking my doctor. And I felt like the questions I was asking him, I felt like, okay, I know this case. I know this story. I've lived it. I've been there. I'm still going through it. So I said, okay, let me help you out by just sheer experience. And Amjad then told his friends, colleagues, and word spread in the country that there's this doctor that understands you or understands your MS. And at that point, I didn't say I had MS. That was part of, like, if you want to call it, I don't want to say I had MS. But I want to take care of MS because people were coming. I felt like, yeah, I could give certain expertise. And by default, with time, I became someone who truly took care of MS. And I learned as we went, every time there was a new medicine, I would be like the first one in the conference, back like in grade school. First row, fingers up. I have a question. I'm keeping track, reading I'm learning about this like I'm in grade school.
Right.
MS, because I always felt like if I'm going to do this, I want to make sure I'm the best I can at this. I don't want to be the MS person who has MS, who treats MS. I want you to see me because I can be the best person who treats MS. And oh, by the way, you have MS. And that's how I kind of came to become an MS neurologist. And then by becoming an MS neurologist, I started seeing, okay, we could be better. We could do better. In the country, we had so much, we still have the experience, the technology, the facilities. But what I noticed is that people didn't know what they had. I always say that people have so much rights, but a lot of times they don't even know what they get.
Right.
And I felt like, well, let me tell you what you get. Let's figure this out. Let's ask. Let's educate you and everyone else about what your rights are.
Yeah.
And so I started doing a lot of advocacy to make the public aware about MS. What is MS? What does it mean to be disabled? What is your right as a disabled person? And that is how I kind of became this voice, people of MS or advocacy or disability. It's to raise awareness, I guess. I saw this, I want to say this niche, or I felt like, okay, this is something I could do, and it seems like nobody else, I don't want to say nobody else, it's not the right term. People probably were. It's just like, there's one phrase I was brought up on, or when I was a resident, my chair, he used to always say, the squeaky wheel gets oil.
Okay.
Make noise.
Yes.
Make awareness.
Yes.
Because if you do that, eventually, if you have you can make noise, but if you have a receptive leadership, they'll hear the noise and you'll meet halfway,
Yes.
right?
Absolutely.
And that's kind of what I did. I said, let's make noise.
You did.
We're here.
Mm-hmm.
And that's what we did. And now I look back, and I don't want to say we have a society because of me, because no, it's not because of me. But we have a society. We now have many programs. We have a community.
Mm-hmm.
And 12 years ago, we didn't have that.
Right.
And when I look at it, some people say, well, why MS? I will say what I'll tell them. Why not every other illness? It's not like MS is more deserving than people with epilepsy. No. Find your voice.
Yeah.
Find, maybe me having MS made me that champion of that voice or that image.
Right.
But I'm sure there's people that can be that champion of other illnesses because they are just as deserving.
Yes. Absolutely.
And that's why I always go back. I'm not the voice of MS. I like to consider myself just the voice of people.
Yeah.
Of the advocate of what people need to be better.
I love that because it's like the perfect transition to our last question.
Right?
I was going to ask, honestly, just to end the conversation on a high note, what's your advice to someone who has been recently diagnosed with MS, and based on your personal experience and based on the patients that you've been treating over the years or the patients that you've been seeing?
You're not alone. It's of being diagnosed with any illness. In the beginning, you're going to feel like it's only you. You're the only person. Nobody else understands you. And people are gonna tell you it's not that bad, or you know what, you're not in a wheelchair, and you're gonna be like, well, I don't care about the fact that I'm not in a wheelchair. I am here right now, or oh, it's not that bad. Look at the other person, and they're true, but we tend to get narrow focused in the very beginning, and we forget that. But just remember, you are not alone. We have a community, and people are trying to help, but sometimes the people around you may not know. It's not like parents get a crash course on how to care for a sick child all of a sudden.
Yeah.
Or a wife or a husband to learn. I mean, we're all learning this together.
Absolutely.
So I think that's the most important thing. Just remember that. Don't be afraid to reach out. And it's all right to be afraid and be scared. You'll find so much strength in yourself. And you have so much opportunity. But it's all right to just cry every now and then. Or to hug someone. Because sometimes we need that. And if I could go back to the very beginning and tell the younger Ahmed what I know now, I'd try to tell him it wasn't that bad. Oh, why did you spend so many years being upset or angry? My biggest fear was being in a wheelchair. Now I'm in a wheelchair. And now one of the things is I'm in a wheelchair and I look at other people in wheelchairs and I say, you want to race? You know what I mean? It's...
Love that.
It just goes to show you, the thing that I was so worried or scared about,
right,
that my world would have ended. In a way, it maybe just started in a different way. And that's why I tell people, don't give up, stay hopeful. And you know what? You will find so much strength in yourself. But metal needs to be heated sometimes before it turns into steel, right? Or is it what iron gets heated to turn into steel? You got to do that to make it harder. So you need to be tested to show your true resilience. If everything was always easy for you, you may never know what your true talent is.
Yeah.
That's what I'm trying to get to. Thank you.
I love that. Thank you so much, Dr. Ahmed. This was so pleasant. I can talk to you for hours. So thank
so
you
much
for everything and for sharing your insight and for sharing your story. I think the major aspect is not just to know more about MS, but to get people to hear your story, because through that they find inspiration. Through that they can get the push that they need to stay resilient and to be hopeful.